Today we're going to explore borderline personality disorder, or BPD, and the recommended treatment. Before we learn more about BPD, let's review the criteria in the DSM. Frantic efforts to avoid real or imagined abandonment. A pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idolization and devaluation. Identity disturbance, markedly and persistent unstable self-image or sense of self. Impulsivity in at least two areas that are potentially self-damaging, such as substance abuse, reckless driving, or binge eating. Recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. Affective instability due to a marked reactivity of mood. Chronic feelings of emptiness. Inappropriate, intense anger or difficulty controlling anger. Transient, stress-related paranoia or severe dissociative symptoms. What does BPD look like?
A lot of crisis, cutting, self-injurious behaviors, negative self-talk.
The classic, go away, no, don't leave me.
Oftentimes what's most common is sort of an affective instability, a real sort of inability to tolerate distress, particularly relationally, feelings of abandonment that seem to be more chronic and entrenched.
A lot of times they've burned a lot of bridges with family members, with friends, just because it takes a lot of energy to sit with somebody that has borderline personality disorder.
While there's a preponderance of female clients that carry the diagnosis, there are also men who do. And again, it may look different through the lens of the gender of the person.
And lots of times they also present with an Axis 1 diagnosis of depression or dysthymia.
Medication.
The medication treatment, it really depends on the symptomatic picture. You have to really tell the patient they have to be regular about taking them, the SSRIs in particular, because they build up in your system and they take some time to work to be effective. So what you see often is a lot of impatience around that, and it's really helpful to orient the client and encourage them to stick with it. The best treatment, psychological treatment for borderline people is group therapy, and a time-limited kind of group or problem-oriented, goal-focused. Also CBT, cognitive behavioral therapy, rather than relational therapy.
Why group therapy?
Because of the whole interpersonal stressors, the group therapy allows the person to practice the skills that they're learning within a group setting. So they're A, feeling like they're not the only ones in the world that have these issues, but B, they're also able to in vivo practice the skills that they're being taught. So the group is actually a very structured kind of portion of learning, review of homework, and learning of a new skill. And so the didactic piece, they can actually practice with other group members, and where they might struggle, they can work through some of that live.
Dialectical behavior therapy is the only treatment that has been shown in controlled clinical trials to be effective in treating borderline personality disorder. What is dialectical behavior therapy?
Dialectical behavior therapy, DBT, was a process that, treatment model that Marshall Linehan came up with. Marshall Linehan is a psychologist who's been at the University of Washington for many years. And as I understand it, it grew out of her work originally with chronically suicidal patients. What Linehan came up with was a model that incorporated a balance between conveying validation and acceptance of the patient's experience and current status with ways of focusing on change while simultaneously giving the message of acceptance, and splitting the therapy into different pieces, including individual and group pieces, which took some of the heat off the individual sessions to do everything all at the same time, and provided a structure, more of a structure for the treatment. And finally, incorporating a lot of support for the therapists and everybody's working with the patient, so that there's a consistent experience for the patient with all the members of the team.
Dialectical behavior therapy, and it's actually an offshoot of cognitive behavioral therapy, and it shares some similarities with cognitive behavioral therapy, but it also has some differences. And so the way that DBT specifically works well with people who struggle with borderline personality disorder is that it's got a very specific set of protocols that is based on the one hand with individual therapy, but also social skills training. And the individual therapy is there to kind of help develop a relationship and an alliance with the client that helps in the ultimate goal of more emotional regulation and more of an ultimate balance within the self.
Throughout this video, we're going to watch 4 different role plays illustrating the 4 components of dialectical behavior therapy. What are the 4 components of DBT?
Distress tolerance, because somebody who struggles with borderline personality has a very difficult time biologically as well as psychologically kind of coping with emotions that are very strong. And there's a biopsychosocial theory that kind of contributes to that, where the idea is somebody's kind of born with a temperament that biologically predisposes them for emotional imbalances, but they might also have a family environment that contributes to it also, with mixed messages and communication patterns. And so that plus maybe some other relationships all contribute to creating a lot of instability for the person.
It's a real negative event for you. You can't do what you planned on. You had all these appointments and now you have to cancel them and reschedule. How can you turn that into a positive event or a positive statement?
Get to watch TV all day.
I get to be alone with no one bothering me.
Make cherry snow cones.
Core mindfulness is a skill set that helps the person develop some awareness of what's happening so that there's a better sense of self-control and the ability to implement skills when needed.
You just close your eyes, get comfortable in your chair, and breathe in, breathe out. Really just feel your breath.
Emotion regulation is helping the person learn ways of balancing the emotions, and interpersonal effectiveness is ways of working with other people in relationships. So the extremes of engulfment or abandonment issues can kind of be worked through, and again there's a bit more balance instated for the person.
Try not to intensify the emotion, just let it be how it is for you. Remember that you are not your emotion. Remember that you don't necessarily have to act on your emotion. Group members use the Dear Man acronym to be more effective when expressing themselves. The GIVE acronym reminds the group to be gentle, interested, validate, and easy-mannered when interacting with others. These skills promote interpersonal effectiveness.
The relationship between the individual therapist and the client is very important because it helps with boundary setting and monitoring of safety, suicidality, and it's a good adjunct to the group portion, which is where the social skills training comes from. So they have a way to kind of have that individual attention, but also in working with a group, they're working with other people who struggle with those issues, and so it's more of a learning environment.
What are some of the limitations of DBT?
And it's a very structured program, but it's also very time intensive, and it's difficult at times to adapt it to settings where you can't have 2 hours a week or more of group training plus an individual therapist plus the person that's able to be on the phone checking in with them if they need check-in.
What are some of the challenges you've encountered when working with clients with borderline personality disorder?
Oftentimes the way I've seen the borderline personality disorder surface with me is in particular with regard to my relationship with a client, because oftentimes I will be the target of their anger or their abandonment issues or their frustration, whatever.
Lots of times I found I might get numerous phone calls, and so I let the person know up front the boundaries behind them calling me, and that I will respectfully get back to them. But it, might take 4 days, and this is the plan if you need, to call crisis or something like that.
It's a challenge to remember and maintain and not get swept away by the energy that's coming at you from the patient.
And you have to walk gently with caring for them and things that you say to them, and they can really drain you to work with them in some cases.
A client that has borderline personality disorder, there lots of times isn't an understanding of what that means and how that's affecting their relationships and their ability to function. And to provide insight seems to take a long chunk of time. It's possible, and I think being straightforward and honest right from the beginning and having some sort of language and dialogue to use to kind of let that person know when what they're presenting is a direct relationship to their borderline personality disorder.
Because of the emotional dysregulation, there may be a tendency at times to feel very appreciated and very, even to the point of overly appreciated, and other times maybe, if something happens where they feel slighted in some way, they might get very angry and kind of go away. So it's kind of an extreme of either or.
What advice would you give to other professionals about working with clients with borderline personality disorder?
Finding out with the client what it is they want to have happen in therapy, what their goal is. So I want to find out what their level of understanding of their diagnosis is, and what they see as limits in their functioning. And from there I'll set boundaries.
You might find yourself most clinically challenged as a practitioner when you're sitting in front of someone who has borderline personality disorder, because they really require much of you in terms of your centeredness and your not letting your ego get in the way, because you might feel attacked, you might feel blamed, you might feel as if you're being somewhat taken advantage of at times. And again, all of these are generalizations, but it's an interesting place to be in because it challenges you. I think it's on one hand it's the most challenging of clients at times, but on the other hand it's also probably some of the most rich experiences to learn as a practitioner, because you really have to check yourself, and particularly with regard to remembering that the person that you're talking to is in a lot of pain, and that they're really annoying to you right at that moment, and you really want to sort of give them attitude right back, but this is someone who's struggling a lot.
To bring it to team, bring it to your supervisor, process what's going on, and keep focused on working with this person to benefit with counseling.
What I'd encourage a person working with borderline personality is to really try to develop that empathy and alliance, and that's what DBT really looks at, acceptance of the person, because the person themselves is fragmented, and so the dialectical approach is kind of appreciating that change is really difficult and necessary, but they're also having to let go of some things that feel very necessary to their being, so they're having to give up something to get something, and it's very threatening to them. So that relationship is a way of helping model that acceptance of self, so that hopefully they can get to the point where they're accepting themselves too.
For more information on borderline personality disorder or dialectical behavior therapy, please refer to the following websites.